Welcome to today's GNCC Espresso Live with our distinguished guest, the Acting Medical Officer of Health for Niagara Region, Dr. Hirji. Dr. Hirji, thank you so very much for being with us. And the same to all of our participants. I'm really glad that you could have are able to join us today. My name is Mishka Balsam, and I will be your moderator for the next hour. Although none of us had hoped that the start of 2022 would be so greatly defined by the rise of COVID cases, it became apparent in late November and early December with the impact of the Omicron variant that we have to take some drastic action, not only here in Canada, but worldwide to contain its impact. Since our December Espresso Live with Dr. Hirji, here are a few highlights that have gotten our attention so far this year. More COVID vaccination dates and appointment times have become available to Niagara residents, which is great to see. Health Canada approved Pfizer's antiviral treatment, which has shown to reduce the risk of hospitalization and death caused by COVID-19. Ontario changed its reporting system on January the 1st to make the distinction specifically for patients being admitted to hospitals for treatment of COVID-19, or if they're admitted for another reason and found to be infected by the virus. Given the Omicron's ultra-high contagiousness, we were and are faced with limited testing capacity. And Niagara Health passed the mandated COVID-19 vaccination program to deal with the significant staff shortages, which we are experiencing in the health sector, but we are also experiencing in many other areas in business sectors across the country. With that in mind, I want to thank each of you for being with us today over this lunch hour to better understand our current situation here in Niagara, our case count, our vaccination update, what to expect, how to prepare for it, and what we can do to turn this around. Often in advance of this Espresso, you, our audience, provide us with questions. This week has been no different, and we have received a record high number, and we're committed to getting to all of them. For those of you who wish to enable live transcript, please refer to the bottom of your Zoom screen for that option. But usually what we do in the format of today's webinar is that Dr. Hirji will provide an update, and then in about 20-30 minutes from now, we will actually follow by our interactive Q&A session. And on that note, Dr. Hirji, may I move the webinar over to you for your overview.
Thank you so much, Mishka. And I will try my best to hopefully address some of the questions that you nicely shared with me in advance in my presentation to hopefully give us a little bit more time at the end for some new questions. And I just want to confirm with everybody that you're able to see my slides.
Yes, we are.
Excellent. Thank you. I know I've mentioned a couple of times that early in the Zoom days, I did go a few times where I started to present without sharing the slides. So I always make sure to check that now. You know, I think what is really defining this Omicron wave that we are experiencing right now, I think, is what's happening in our hospitals and how much our hospitals have been stressed. And the unfortunate announcement that we had, I guess it's going on about close to 2.5 weeks now, when the province announced some restrictions on some of the kinds of businesses that really interact with the public, was really driven by hospitals starting to feel a lot more pressure. And the goal was to really reduce the number of people becoming hospitalized by slowing the spread of infection. And so I want to start off just by taking a look at what the hospitalizations look like here. And so these are the hospitalizations province-wide here, I'll start off with. And this is what it has looked like. And as you can see, the hospitalizations are right now province-wide for people hospitalized with COVID-19, far higher than they were at any of the previous waves of infection that we have seen. When we take a look at the ICU numbers, you can fortunately see that number hasn't risen nearly as much. It is higher than either the first or the second waves. It hasn't quite reached the third wave yet. So there's a little bit of a silver lining that while more people are being hospitalized, they're not necessarily becoming as severely ill that they need ICU care. But nonetheless, this pressure on the hospital is significant, and even the number of people in the ICU, while it's not as high as it's been in the past, is of course a pressure on our hospitals. If we take a look here in Niagara, this is what Niagara Health has been reporting out in terms of its hospitalizations. And a very similar story where the number of people hospitalized who have COVID-19 is well exceeding the peak of what we had in the third wave, and the third wave was very similar to the second wave for us. If we take a look at the ICU numbers, it's perhaps not quite as optimistic as the province, where the ICU patients right now in Niagara are actually pretty similar to what they were during the third wave. But fortunately, they're not far higher the way hospitalizations have been. Now, Mishka, you're talking a moment ago about how the province has started to make a bit of distinguishing between the hospitalizations. Those who are hospitalized for some other reason and happen to test positive for COVID-19 versus people who are hospitalized truly for COVID-19, and that's what they are primarily being treated for. And Niagara Health has started to report on that. So I can draw in this little blue line here that shows you what that looks like. And fortunately, you can see there's a number of people who are hospitalized for reasons other than COVID-19 who unfortunately also have the infection. Unfortunately, even when we look at the number being treated for COVID-19 right now, it does exceed where we were during our previous waves. And so that it is still a significant number, though fortunately not as much. We do need to be mindful, of course, that the people hospitalized here, while they may not be treated primarily for COVID-19, they are nonetheless a pressure on the hospital. Of course, they need to be treated for whatever they were admitted for. And once they're diagnosed with COVID-19, they need to be isolated. There are enhanced precautions that need to be taken around those patients. So it does end up increasing the workload and the pressure on the hospital, perhaps just not quite as much. And hopefully these individuals are less likely to pass away because they're not infected with this illness. I've, in past presentations, talked about our case numbers here, and I'll speak a little bit about them now, but I think they, of course, need to be de-emphasized because we're not testing everybody anymore, so we don't have a true sense of what are the true number of infections out there. If we look at what the pattern looks like Ontario-wide, it looks something like this, where this is the date where the change in testing occurred. And you can see since then there's been a drop in our number of cases, but that's because we are testing only a small subset of the population. And so it is not really an accurate representation of what are the number of infections we have are. I do show that just because, I think what happens with that high-risk group who is getting tested, to people who are hospitalized, to healthcare workers, perhaps if we start to continue to see that going down, that could be a sign that in that high-risk group, there are fewer infections. And maybe that might carry over to the population as a whole. Here, it does seem like there's a downward trend there, though I think we have to take that with caution, as I've explained, because it is not representative of the entire population. Particularly if a lot of healthcare workers are being tested. They were, of course, one of the first groups to be able to get a booster dose. So they have added protection. And so over time, we would expect them to be less likely to get infected because they're increasingly getting those booster doses and getting the protection from that. Likewise, in long-term care homes where we're delivering a second booster dose, effectively a fourth dose for them, they're increasingly getting more protection. So we'd expect their likelihood to be infected to go down. That doesn't necessarily carry over to the rest of the population where the booster doses haven't been rolled out quite as quickly. Quickly taking a look here then at what the cases look like here in Niagara as well. You can see the big increase before the testing criteria changed. And since the testing criteria have changed, those numbers have come down, but again, it's not representative of the population as a whole. Of course, a big question I think we all want to know is when are we going to peak and start to see these cases come down and start to be able to back on some of the measures we're taking around the Omicron wave. And I've highlighted that maybe if we consistently see this downward trend and it implies that infections are going down in higher risk persons and healthcare workers, that might be an indicator it's happening to the rest of the population, though with the caveats of them getting their booster doses earlier, it may not be that reliable. Another area that we can look at is wastewater surveillance. COVID-19 is excreted in the human waste that we flush down our toilets, and we can actually pick up evidence of that in wastewater. And when you pick up more of it in wastewater, it is supposed to correlate with there being more infections out in the community. One challenge I have found with this data is that it is not extremely reliable data, and it gives you a very messy signal. And I'll just show you here that this is the data we've been picking up from the Grimsby wastewater treatment plant. These are the different days, and these are what was measured on various days. And so you can see there's this big spike on one day that occurred in early December. It's surrounded by days which were very low. So not sure why there's a big spike. And then you don't really see much here. And of course, through the latter part of December is when we saw case counts really go very high up with the Omicron wave. We definitely saw a large number of people diagnosed with COVID-19 in Grimsby. But unfortunately, the wastewater didn't really pick that signal up. And then our most recent data, which is from about a week ago, shows a big increase here again on this at least one day. But I think you can get a sense that there's not really giving us a clear pattern that matched the increase of the Omicron cases. And it's not necessarily giving us a reliable sense that we're in any way on the way back down. Fortunately, I think a couple of our other wastewater plants maybe are giving a little better signal. So this is the Port Weller wastewater plant in St. Catharines. And this is what it shows us here. And this makes a little bit more sense, where you do see increased signals picked up in the wastewater in the middle of December, which matches when we are seeing the COVID-19 cases spike upwards. So that kind of makes sense. Unusually, though, you're not seeing it consistently go up. It just sort of stays kind of flattish there for a little bit. We have this big spike on December 29th. That probably makes sense if you're thinking about holiday gatherings might have led to a lot of spread. There might have been a little bit of a spike of people getting sick shortly after the holiday, so that makes sense. And then we have, a sense that there's ongoing high amounts of COVID-19 being excreted into the wastewater here. Not really a great sense if it's increasing or decreasing. It sort of looks like it's plateaued at a high level. There's one day where the measurement's a bit lower, but I don't want to put too much stock into one-day measurements because things do seem to fluctuate a bit. So that's what the Port Weller wastewater plant shows us. If I'm looking at the Niagara Falls wastewater treatment plant here, this is the data it shows. Again, it's actually, shows a little bit of an increase here around the time we saw cases go up, which kind of makes sense. We see a big spike just after the Christmas holidays again, which sort of makes sense again. And then in the early part of January, we're sort of seeing a bit of a flat trend, no really sense of it going up or down. And I think it's difficult to conclude too much from this wastewater data, but I think what we can say is that there's probably lots of COVID-19 still going around, and there's not really a clear sense that it's on its way down or it's fortunately either on its way up. Perhaps it is maybe plateaued and is staying flat at a high level right now. And maybe that could be a precursor to hopefully it's starting to go down in the future. We'll have to wait and see. Another way I'm trying to get a sense of what's happening with cases is actually looking towards outbreaks. If we have more infections out in the community, we'd expect more infections to find their way into the healthcare facilities where we are tracking outbreaks. And this is what we've seen in terms of our trend with outbreaks, where through late December, early January, seeing a definite trend upwards in outbreaks. And it's maybe flattened out over the last little while. And so maybe, again, this does kind of match with the wastewater. There might be a sense that infections are still quite high in the community, but maybe they're flattening out and not necessarily continue to go up quite as much. And so, I'm hopeful that this data together is letting us know that we've maybe hit some sort of peak in terms of our infections, and maybe we can start to see it come down, but not a clear sense that it's on its way down yet. So we are probably in for a little while longer, in terms of a few weeks longer, of seeing our hospitals really stretched with people getting severely ill from COVID-19. I mentioned earlier the measures the province has taken, particularly measures on restrictions of some of the businesses that cater to social activity. And that's really, again, about breaking up people's social interaction in the hopes that if there's less social interaction, there's less ability for the virus to spread, fewer people who are sick who can be hospitalized if they get severe illness, and that is going to hopefully help us through this situation. This orange line, which I've talked about in past months, represents people's mobility, how much they're out and about. And you can see here that there's been quite a sharp drop off in early January. And actually the mobility has dropped actually not too dissimilar from where it was back around this time last year, which is when we were in a lockdown. And so this actually does seem to imply that those measures the province put in place, as difficult as they are, is reducing people's being out and about and hopefully interacting with each other, and hopefully is leading us to put in place conditions that's going to slow the spread of infection, which might be why we're maybe seeing some signs that maybe the infections are flattening out, as I've shown you. If I take a look here in the Niagara data, if we're looking at shopping and recreation, you can similarly see a big drop off in people being out and about shopping and recreating. In Niagara, it's not quite as low as we've seen in previous lockdowns, but definitely a decrease, which is good. And then in terms of people staying home, you can see we've had an increase in people staying home. And again, this is actually maybe only a little bit lower than we've seen at previous lockdowns. So I think that's definitely some good news. That's hopefully going to reduce the burden of illness out in our community by slowing the ability for infection to spread. The Public Health Agency of Canada last Friday put out some modeling of what they expect to see with the Omicron surge going forward. And this red line here represents what the Omicron wave would do if left to its own. This blue line represents what's hopefully going to happen thanks to some of those measures put in place to reduce people's interaction with each other. And if you can look here, they were predicting that between January and February, sometime in the middle, we might get to a peak where infections might hit their max. And thinking back, I was showing that our wastewater data, our outbreak data is showing maybe a bit of a flattening out. I'm hopeful that's exactly what we might be seeing, that this modeling is right, and that we are actually seeing kind of that flattening out part near the top of the peak. And we might be hopefully getting close to a point where we can start to see cases come down. Now, of course, if cases are coming down, hospitalizations tend to lag cases, so that will take a little bit longer. And this is what is modeled in terms of what we might see with daily cases. This dashed green line is the maximum of daily new hospital admissions that had been seen during past waves. And so you can see our daily hospital admissions are modeled to be much higher than they have been in past waves, which I think is exactly the experience that we are seeing here in Niagara and in Ontario with record high hospitalizations. And you can see that after a peak occurs in maybe mid-January, it really takes us to the end of the month before new hospitalizations fall below that historical maximum and are on their way down. But of course, we are still going to be adding more hospitalizations for a period. And noting, of course, past waves, the hospitals have been stretched. So even if we get down to this dashed green line, while it's a good sign that things are improving, it's not necessarily means that hospitals are in the clear yet. So, I think we are looking, at least for a couple more weeks of our hospitals being in really intense pressure. And then we'll have to see how well they are able to cope, because they'll, of course, have a whole bunch of people hospitalized already. Fortunately, not seeing as many new people coming through their doors needing care, but will they really be in a place where they can handle things? And, I really do wonder how well prepared we are going to be to hopefully lift the measures on January 27th to reopen a lot of what had to be closed at the start of this month. I do worry that given things are going to be quite bad in our hospitals, those measures might need to be extended past January 27th, or perhaps, maybe lifted somewhat, but not completely, and extended in maybe a partial form going forward to make sure that we don't just reopen and allow the pressure on the hospital to resume right away. I hope that over the next 8 or 9 days, we'll see some really good news, which will mean that we can move more quickly at that. But I'm not necessarily very optimistic at this point that that's necessarily how it's going to play out. Aside from these measures that the province is doing, which I think are the most painful measures in terms of reducing the spread of infection, of course, the other really important thing that we can do is to get vaccinated and get our booster dose if we're eligible for that booster dose, because that is absolutely going to slow the spread of infections. And just to give you the quick update on vaccinations, this is, first dose vaccinations for people. Unfortunately, you can see our age 5 to 11 are a group that is lagging a little bit in terms of them being vaccinated. These are our second doses. Children are just starting their second doses, so I expect over the next couple of weeks we'll get this number well over 40% as well. And then these would be our booster doses. Under 18s can't yet get the booster doses, but you can see in other age groups. And particularly in our eldest age group, who is at most risk of severe illness, we're thankfully have quite high rates of those booster doses being out, and these are continuing to go up. Of course, we need to get everybody their booster dose to make sure everybody is as best protected as possible going forward. I do want to highlight here that if you look at, just under 90% of people have got a first or second dose. Over half of that 90%, 45.8%, already have their booster dose. And so that means that of adults, more people have their booster dose than have a first dose, have a second dose, or are unvaccinated. The largest group in our society are people who have actually gone out and made that very good decision to get that booster dose, which I think is very positive. But of course, we want to get this line, green line, up much closer to where the other ones are. As we continue to try and convince other people to get their vaccinations, we are fortunately seeing more first doses going up and second doses going up, and of course, lots of booster doses being given. I really do hope we can try and convince more parents of the importance of vaccinating their children in the 5 to 11 age group, particularly with children going back to school. They're of course going to be around lots of people, and there's of course, when you're around people, risk of infection spreading. And I think having them give the protection of a vaccine is going to hopefully make their ability to stay in school and stay healthy in school much better. And of course, reduce the chance that they might get an infection and bring it back to the home where perhaps there are older people, more vulnerable people who might get more severely ill. I just want to highlight, the scaling up that we've done in terms of vaccinations here in Niagara. So you can see through, this late summer, fall, we are doing 1,000 to 2,000 doses a day. By early November, we are, under 1,000 doses a day being done in Niagara. And as you can see, in many days, we are now actually hitting 6,000 doses a day. We had dips around Christmas Day, New Year's Day. We dip a little bit on weekends. Unfortunately, yesterday was quite low given the impact of the snowstorm. But most days we are getting close to 6,000 doses being given out a day. So we've substantially increased the ability to deliver vaccinations. And, I think we actually have room to be higher. I think we can actually deliver close to 8,000 doses a day. We've unfortunately seen people not really taking up all the appointments that are available. I know a month ago, everybody was very anxious to get an appointment for a booster dose and we couldn't keep up with the appointments. We're now at a point where we're delivering 8,000 appointments or so a day, and we're only managing to fill about 6,000 of them. And there's, of course, many people I just showed you who still could get a booster dose, who still don't have a first or second dose. And we really hope people will take the opportunity in the next couple of weeks, while the Omicron variant is still circulating and still stressing our hospitals, that everybody will get their vaccinations and make sure they get that additional protection. So hopefully they won't end up being one of those people who's going to add pressure to our hospital. And more importantly, of course, protect everybody around us so we're not spreading infection to our loved ones. There's some talk out there about how the vaccine has performed against the Omicron variant. And I just want to highlight, what we are seeing. So this dark line here is how well the vaccine is preventing infection. And you can see, back in August, September, October, when we're dealing with the Delta variant, that vaccine was 90% effective, was really staying strong, only maybe a minimal decrease by a couple of percentage points over that time. It wasn't really waning. We had really good protection. You can see in mid-December, as the Omicron variant basically takes over, we saw this sharp drop off in the ability of the vaccine to prevent infection. Now, fortunately, if you look at this yellow line for hospital being protected from being hospitalized, or this orange line being protected from being admitted to the ICU, the vaccine absolutely was protecting people from that. A little decrease in its ability to protect you from being hospitalized, a small decrease in the ability to protect you from being admitted to an ICU, but still really excellent protection for that. So the vaccine has absolutely continued to work really well to prevent severe illness. Unfortunately, it did allow people to start getting just mild infection. And actually, a lot of people we were diagnosing with COVID-19 in December really actually had no symptoms, sometimes had a cold. So they were getting sick, but they were not getting severely ill. What you'll notice is that in the last few weeks, we've seen this big increase in terms of how well the vaccine is performed. And that is actually a reflection of booster doses, because we're looking here at people with at least 2 vaccine doses. And as a substantial portion of our population, that 45% of our population has gotten a booster dose, we start to see the vaccine start to work much more effectively at actually preventing infections, and even a small uptick in its ability to prevent hospitalizations and ICU admissions. And of course, we only have 45% of the 90% of people who started to get vaccinated to get that booster dose. And so I think that, probably protection of people who have that booster dose is probably up somewhere here close to 80%. And so if we continue to get those booster doses up, I think we can see this line come right back up here. And of course, once that line is up there, that means we're stopping infections thanks to the vaccine. Many fewer people are going to be getting severely ill because they won't be getting ill in the first place. And that will really help put an end to this Omicron wave and let us start to go back to having things open up in society. And so I really do think encouraging people to start to come and sign up for those vaccination appointments, which are going empty right now, remains a really key thing we need to be doing to hopefully get past this Omicron wave in a way where everybody gets protection and we're able to get our society back operating to normal and get our economy back functioning back normal again. Just want to highlight some of the national data here, which again shows the impact of vaccination. And you can see the how many likely someone was to be hospitalized if they're unvaccinated. This was the risk of hospitalization if they're unvaccinated versus vaccinated back in September when we're dealing with a Delta wave. Now that we're dealing with the Omicron variant, you can see it's not quite as big a gap, but still, unvaccinated people are 19 times more likely to be hospitalized than someone who's been fully vaccinated with 2 doses of that vaccine. And so that vaccine continues to absolutely give really good protection. And just to talk a little bit more about this, I just want to talk about some of the data we've seen coming out of the UK here. So this is the technical name for the Astrazeneca vaccine. In the UK, the Astrazeneca vaccine was developed in the UK with partnership with Oxford University. And so they had about 2/3 of their population vaccinated with the Astrazeneca vaccine. More recently, they've been doing booster doses with either the Pfizer vaccine, that's what this is, or the Moderna vaccine, this is. And you can look here, this black dots, they're black squares here with the Delta variant, and this is how effective the vaccine was. And so in the UK, they found the vaccine was about 80% protection against the Delta variant, falling to maybe 45% after about 6 months. We didn't really see that drop off here in Niagara. Our protections remain quite high. And that's, of course, because we use the Pfizer and Moderna vaccines, which are better vaccines than the AstraZeneca vaccine. You can see then with the Omicron wave, you start to see lower protection from the vaccine to the Omicron variant. And sadly, you can see the Omicron variant, once you go about 6 months out, is basically at 0% effectiveness. It's not protecting against infection. Now, it's not shown on this graph, but the 2 doses of that AstraZeneca vaccine absolutely still give lots of protection against being hospitalized or being admitted to an ICU. It's upwards of 70% protection from being hospitalized. So it's still working very well, but like the Pfizer and Moderna vaccines we used here, protecting against infection has fallen off. When people got a booster dose then of the Pfizer vaccine, you can see protection against that Omicron variant really jumps back up. And it actually jumps up to being higher than it ever was with just those 2 doses of vaccine. So that shows you the booster dose really has an impact in improving people's protection. And you can see a bit of a decrease over time where it gets above 60% protection and unfortunately falls back down to 40% protection after about 10 weeks. What I think is interesting is that when you look at the Moderna vaccine as the booster, you actually see that the protection jumps up higher than it was with the Pfizer vaccine. You're not just getting up to 60+%, you're actually getting close to 70% protection. And then over time, you can see that the Moderna vaccine, the protection wanes a little bit, but it doesn't wane as much as the Pfizer vaccine does. And so it does seem like getting that Moderna booster after your 2 doses of AstraZeneca really actually gives you substantial protection and actually even better protection than the Pfizer vaccine. Either vaccine, great for a booster, gives you that protection against infection, but it looks like there's a slight edge for the Moderna vaccine right now. Of course, we didn't use very much AstraZeneca here in Canada, so this is actually the UK data here on 2 doses of Pfizer vaccine and then a Pfizer booster or a Moderna booster. And you can see with the Omicron variant, the protection from the Omicron variant starts up around 60%, but then falls down and is maybe at 10–15% after about 6 months, which is very similar to what I showed you in that previous graph we're seeing in Ontario. They get that booster dose of Pfizer, their protection jumps back up to 70%, unfortunately declines to maybe 50% over time, but definitely much better protection than without that booster. Again, with the Moderna booster, you're not just jumping up to 70%, you're getting close to 80% protection, and you don't really see that drop off in protection with the Moderna booster. And so again, it does look like the Moderna vaccine has a slight benefit when it comes to protecting against the Omicron variant. And if anybody's been to some of our vaccine clinics, you'll have seen this information where we are giving people Moderna vaccine if they're age 30 years old and over, because the Moderna vaccine does seem to give stronger and longer lasting protection, especially to the Omicron variant. People under 30 will get the Pfizer vaccine because the Moderna vaccine does seem to cause myocarditis more often in someone under 30. And so we don't want to give them that side effect. People under 30, of course, are also less at risk of having severe illness, so they don't necessarily need the protection as badly. And so I think it's a sensible trade-off that will protect them from the side effects. They'll still get very good protection, maybe not quite as good as a Moderna, but they don't need quite as good protection anyway because they're certainly at lower risk. And so, if you are hearing people who are unsure about getting the vaccinations because of the Moderna vaccine, this is why we're giving the Moderna vaccine, because it is giving people better protection against the Omicron variant, which is, of course, the name of the game right now. Last thing I just want to quickly touch on is, of course, keeping our workplaces safe during this time. And this is very similar to advice that I've talked about in the past. Of course, with so much infection going around, whenever people can work remotely, that is, of course, going to be best to keep people safe. That way they're not around others where there might be a risk of infection spreading, particularly affecting many of your workers at the same time if there is an outbreak. Daily screening, if you are bringing people into the workplace, is really important, making sure that they have no symptoms of infection. If they have symptoms of infection, that's a really easy way we can make sure we limit someone who could have Omicron coming into our workplace. I've heard some workplaces are requiring people to have a test to come back, and I'd really recommend you don't do that because, of course, the ability to get tested is very limited right now. So most employees won't even be able to get a test, and I don't think it's a realistic expectation. If you do have access to rapid tests, I think that can be something you do where periodically you would give people a rapid test before they enter the workplace. It's kind of an adjunct to screening. There's a question in the comments provided of how reliable are rapid tests. Rapid tests I don't think are perfect. They probably will pick up 70% or so of infections out there. They're not going to be 100% protection. You can test negative on a rapid test and still have COVID-19. But if you're picking up an additional percentage of cases, I think that's really useful. And it's a really good way to hopefully limit people getting into a workplace with infection. So I absolutely do think rapid tests are a good way to augment your screening to have a better confidence that people with infection aren't coming in. You just need to be mindful that they're not going to be 100%. So there is going to be some error rate. So just because people have all got a negative rapid test doesn't mean you want to drop all of your other precautions, because we need to have those other precautions in place to keep us safe. Rather than testing, I do recommend a vaccination policy in terms of bringing people back into the workplace, as that's going to be, I think, your best protection to make sure you limit spread of infection in the workplace. Continue to recommend that if people do have any signs of infection, we want to force them to isolate so they don't spread it to others. And if a workplace can have sick policies that are supportive of people staying off of work when they are sick and not making them feel pressure to come back into the workplace, that's, of course, going to limit the spread of infection, especially to your employees and to your customers. Of course, we all want to keep using masks and eye protection going forward, making sure, especially with goggles or face shields, we are disinfecting them after use. With masks, we want to make sure we have a good fit around the face so that we don't have any air escaping in or out, which the infection can spread through. Making sure people stay physically distant as much as possible on the job. And particularly, vehicles are a place where you can't really stay 2 meters apart from others. So if people can travel independently rather than together in vehicles, that's going to reduce their risk. Breaks and break rooms are, of course, when people are going to let down their guard. They're going to take off their masks so they can have a snack, drink a coffee. That's going to be a higher risk place where people can spread infection. So if you can encourage people to even leave the workplace and have their breaks on their own somewhere, or spread people's use of the break room out so you minimize the number of people in there together, that's going to hopefully reduce the chance that people are going to get sick from exposure in the break room. And of course, doing what we can to improve ventilation and filtration in workplaces is going to hopefully remove some of that airborne virus by filtering it out or basically exchanging it with clean air outside. And of course, it remains a provincial requirement to have a workplace safety plan. And with that, I'll stop there and I'll turn over to some questions.
Dr. Hirji, thank you so very much for the update. It's always greatly appreciated. And by you giving us the update, actually, you have been able to address quite a high number of questions that have come in. But nevertheless, there are a number of others that we would like to address. We got questions in that are related to masks. We got questions related to when is someone fully vaccinated or not, meaning 2 shots, 3 shots, what should it reflect now? What does the forecast look like? What can we anticipate and expect? And these are just some of the questions that we would like to get to. I wanted to also let our audience know that if you want to ask a question, many of you have already submitted them to us via text text or social media channels or via email, and we are committed to getting to all of them. But for those of you who also have put quite a few questions in the chat, we're seeing them and we're trying to get through all of them. So let's start out with the ones related to the booster shot. And here is one that I think captures quite a few questions that a number of other organizations have put in place too. And this is from Kelly. Their organization implemented a mandatory vaccination policy last September and have full compliance across staff and volunteers based on 2 doses. Our definition of being fully vaccinated according to Health Canada. Do we need to validate or bring in and saying it has to now be a 3rd booster to be included, to be part of that definition? And I think that is a question that quite a few businesses are having and would love your input on it.
Yeah, so, I showed you the data that shows the protection from infection increases really substantially after that booster dose. And with just 2 doses, we're maybe closer to 15% protection. So I do think that we need to move in the direction of getting 3 doses being the new definition of fully vaccinated. I don't think it should happen like right this moment though, because not everybody's had that opportunity to get the booster dose. But I'm thinking, once we get to late February, people have had the chance to all get their booster dose at that point. And I think probably by that point, we should be transitioning over to using 3 doses as a definition of being fully vaccinated. Recognizing, of course, if anybody's gotten their 2 doses and they're not yet at 3 months, we'd of course consider them on their way to becoming fully vaccinated and consider them to have protection at that point.
Yeah, and that kind of announcement would actually come forward probably from either Health Canada or the Ontario Public Health. That would actually say this is how we are defining now someone to being fully vaccinated, as it will have an impact on traveling, on a number of other areas as well. So yeah, I think it's good. The second question that has come forward and was sent to us via email actually relates to the time frame, how long the booster actually shot really lasts, how long it is good for, because this is something that individuals are running into as well, especially those ones who had their 1st and 2nd dose quite early on in 2021. And now they're saying, I am fully vaccinated, but is that vaccine still good? And how long is the booster shot good for?
Yeah, so unfortunately, I don't think we really know. It's only with the passage of time we'll see what happens with the booster shot. Some countries like Israel have gone ahead and are actually doing a 2nd booster dose. They did actually have a shortened interval between that 1st and 2nd dose, which actually led to their immunity actually declining much more quickly. Whereas when we spaced out our 2 doses, immunity actually stayed quite good until we hit the Omicron variant, which had abilities and some mutations which led it to escape the ability of the vaccine to actually fight it off. With that booster dose, we seem to restore it. My hope is that hopefully it'll last long term, but I don't think we know for sure. And it's only with passage of time we'll know for sure.
Yeah. That sounds fair. If I'm shifting here for a moment from the booster shot, although I do believe there's more questions that are going to come forward on it, but I want to address some of the ones that are related to masks. We've heard that cloth masks are ineffective and that N95 masks should be substituted for surgical masks. Can you tell us what kind of mask is best, and if there are some circumstances in which it is okay to wear a more inexpensive mask?
Sure. So, I think the issue with cloth masks isn't necessarily that they're ineffective. It's that they're an unregulated product, so you just don't actually know what the protection is giving you. Conceivably, some of them are very good and giving you quite good protection. Probably some of them are not very good at all and not giving you protection. I think if you are using a cloth mask, the key thing I'd want to look out for is that you have at least 3 layers or 2 layers and a filter in there, and that those layers are actually a tightly woven cloth, not a very loosely woven cloth. And if you have that, you probably have a pretty reasonable mask. The other key thing is that on top of the construction of the mask is you need the mask to actually fit properly around your face without big gaps. If you have big gaps, of course, that means air can get in, you can breathe air out. That means that any virus is going to travel in the air in or out, and it's not going to give you the benefit of the filtering, which is what the idea of the mask is, that when you're breathing it out through it, it's actually filtering out virus from there. Because we can't be sure of how good a cloth mask is, many recommend that you might want to go to a medical mask, because that is now a regulated product. There are clear standards, and we do know that's actually going to be effective at filtering the virus. And then there's the argument to move up to an N95 or KN95 or KF94. These are all just different versions of a high filtering respirator. there's no, strong science showing that it's actually reducing infections, but they do have higher filtration, and they would theoretically perhaps filter more virus out. And so as a precaution, many people argue that we should move over to those. I don't necessarily want to strongly recommend them because I don't think we have the science showing that they are definitely reducing infections, but I think it's definitely an option there. If you want to get the best possible protection, definitely you can sign up for one of those. But the key thing, I think, most important thing is having a mask that fits properly around the face, doesn't have any gaps. Make sure it has at least 3 layers or 2 layers in a filter. And if you get the medical mask, you reliably have protection. And with the N95, you have the best protection possible.
Okay, thank you very much. There is another question related to mask as well. And if you could clarify the mask rules and exemptions for businesses such as personal services where social distancing cannot be maintained. Does a mask exemption still apply if people have to be close to one another to perform a personal service? And can a business refuse to serve someone with a mask exemption?
Yeah, so right now the rules, because we've gone back to a modified step 2, is that if you're providing a personal service to someone, they need to be wearing a mask right now, and they cannot take off that mask. So, if you're doing any kind of personal service around the face, like say like a nose piercing, people, that would not be permitted right now because everybody needs to be wearing a mask. Hopefully once those restrictions are lifted, we'll be able to go back to maybe doing some of those services. But otherwise, you need the client to be wearing a mask, and you as the employee would be required to wear a mask and some eye protection. The logic being there is that the virus can actually infect you by getting in through the eyes, and having some goggles or a face shield will block that and actually reduce the risk of that. If you have 2 employees working in close quarters, that's a similar rule where you need to have both employees wearing a mask and wearing eye protection. For the question of if someone has a mask exemption, are you able to not serve them? That's a bit of a legal question, so I don't think I can give you a confident answer on it. So I think you'd really need to consult with a lawyer to be sure of what the rights around that are. Particularly, I think that might get into some human rights issues. So I don't want to say that you can act one way or another on that.
No, that's completely fair. This question is coming forward from the wine sector, actually the wine industry, and they're asking, how confident are you that the Omicron variant could be the beginning of the end and things will return to somewhat normal again? And this has been in the news quite regularly over the last 6 to 8 weeks. The different scientists have looked at it. And is this actually maybe a good indicator of where we're at?
Yeah, I don't want to say necessarily anything implying that this is good, because I think this Omicron wave is definitely bad news. But the end game of the pandemic was always we get to a point where people have enough immunity that we can see a big surge of infections, particularly a big surge of hospitalizations that affect our hospitals. And with people getting booster doses right now, that is hopefully going to get us closer to that point. And with, unfortunately, people getting sick from the Omicron variant, especially unvaccinated people, that's hopefully going to give them some immunity as well. And so we'll emerge from this wave where there's much higher immunity across our society. And so we'll be very close to that point, hopefully, where we are not going to see big waves of infection anymore, and we can actually start to move past this pandemic. The big wild card here, though, is variants. And if we see new variants pop up again, it could completely throw us, backwards, as unfortunately the Omicron variant has done. And so I think that's the one reason I can't be very confident that it will play out like that. And I've talked in past months, one of the key ways that we're going to prevent that is that we make sure we help vaccinate the rest of the world so they can get their infections under control and we stop seeing new variants emerging.
Yeah, it makes sense. This is a question from Michelle. And can you clarify the recommendations for isolating the symptoms, positive tests, or exposure to a case? And there have been quite a few questions that have come forward via the chat, via email, related to even schools, students, but also employees at the same time. And anything that can help employers and family members and people to actually really follow the best guidelines.
Yeah, and it's unfortunately complicated, so I can totally understand why people are finding this very confusing. I'd say the simple rule of thumb here is if someone is fully vaccinated, which that currently means the 2 doses of vaccine, You would isolate for 5 days if you get sick with symptoms or test positive for COVID-19. And you'd also isolate for 5 days if you have had a close contact with someone with COVID-19, particularly a household contact. If you are unvaccinated or only have 1 dose of vaccine, those become 10 days. So you isolate for 10 days with symptoms or 10 days with a positive test of infection. And likewise, you'd isolate for 10 days after close contact with someone who has infection, particularly someone in your household. That would be the simple rule there. Then there are some exceptions, because at 5 days is quite aggressive, and some of the science is saying that you're probably not necessarily always past being contagious by then. So healthcare workers, while their isolation may end at 5 days, they are supposed to stay off for closer to 10 days. We're having some discussion in both our schools about maybe if we want to maybe not go quite as long as 10 days, but maybe something closer to 7, and not necessarily isolating for that long, but maybe having classes off to make sure we limit the spread of infection. Nothing is final on that front, and particularly with schools, there'll always be a letter coming home with a parent to advise them of what they should do in that case. So I wouldn't focus too much on that. I think the key is fully vaccinated 5 days, unvaccinated 10 days, and that's probably the simplest rule of thumb there is.
That sounds good. Excellent. Thank you for clarifying that, because there are a high number of questions on this one. I want to go back to rapid tests. There's a question here where we're being asked if there is, do you know if there or will be an increase of access to rapid tests, as they've been of late very hard to find? And yet it has been very encouraging for people who have access to those tests. And I personally just want to say that we are one of the chambers who have distributed them through small to medium-sized businesses. The uptake has been extremely high, but we are, along with chambers across Ontario, have no access currently to further supply of it. So we're working on it, but we are waiting for that as well. But if you can speak to that, because it has given people some sort of peace of mind of what they're dealing with.
Yeah, and it also lets people know, are they infected with COVID-19 and need to isolate or not? I think there's a lot of real benefits. Unfortunately, what we ran into is the entire world started to face the Omicron variant at the same time, had huge surges of infection, and started to need a lot more rapid tests. And basically, we used up the global supply of rapid tests pretty much very quickly. I know our companies that manufacture these tests are really ramping up production, and I'm hearing Ontario and Canada are supposed to start getting a lot more rapid tests by the end of this month and then into February. So I'm hoping that, last week of December, which I guess is even actually next week, and then into February, we'll start to have much more access to those again. Yeah,
that makes sense. A question to school-age kids. Do we have a sense on when teens will be able to obtain a booster? Any chance or any indication there for different age groups that are there, that are in the younger, that maybe currently are in high schools or elementary schools?
Yeah, I don't know what the timeline for that is. I know the National Advisory Committee on Immunization is actually going to be discussing it in the very near future. The debate I believe they're having here is that with every dose of vaccine, of course, you get greater protection. But with every dose of vaccine, of course, the potential for side effects increases. And we've seen particularly myocarditis, pericarditis being a side effects in young people. And I think we want to be very cautious about that booster dose and the potential that we could be giving young children myocarditis or pericarditis, especially since vaccine effectiveness seems to be better in young people. So they don't seem to have that waning and have less need for the booster dose. And likewise, their risk of getting severe illness is already very low. And with that vaccination of 2 doses, it's going to be extraordinarily low. And so is it really worth the, admittedly relatively small risk of those side effects for probably actually very little benefit as well? And so I think that's the debate they're having. And I'll wait for their guidance in the coming weeks as they study, the science and the data on this of what makes sense.
Related to this one, and this is a question, and there have been a few attendees and participants who are wondering why the tracking of cases in schools have kind of stopped at this point, or if it's not necessary anymore.
Yeah, so this was a decision made by the provincial government, and I think it reflects, again, the limited testing there is, that there wouldn't necessarily be testing of all people who have symptoms, of all students or teachers who have symptoms. And so there wouldn't be an accurate sense of the number of infections out there. And they decided to make it just sort of a blanket that they would stop reporting infections and move away from that as a focus. We're having some discussion with our school boards because I think to the extent where we do find people are infected, it would be good to let parents know so that they could make decisions around that. And so we're hopefully going to maybe see some potential to do that locally. We're still in discussion with our school boards of hopefully trying to make that happen though.
Okay. And I have to come back on the policy when it comes to staying at home or not, because there have been 3 individuals here who have actually asked a follow-up question, and I think it makes sense. If people are still symptomatic at about day 4 or 5 of their isolation, are they then to make the call to stay isolated for an additional 5 days?
Very good question. They should stay in isolation, but it doesn't need to be for 5 days. It just basically needs to be until their symptoms have largely been gone for 24 hours. Now, lots of people, when they get an infection, they'll kind of have this like lingering cough, but everything else has gone away. We would say at that point that your, symptoms have gone, you're good to come out of isolation. So what we're really looking is for your major symptoms to be gone. You can maybe have some of those lingering symptoms gone. And once those are gone, you're good to come out of isolation. So if that happens on day 6 or 7, you can come out then. There's no need to stay for the full 5 additional days.
If people have had a test, they tested positive with it, with the COVID-19, either one of the variants that are there, has the immunity overall increased for future variants, or is that just a myth that exists?
It has increased, and it is going to give you some protection against future variants. But it's sort of like the vaccine that, we had a vaccine that worked really well against the previous variants and the Delta variant, didn't work quite as well against the Omicron variant. And you could see that again with the, past infection, where it's going to give you really good protection, but not necessarily to something like the Omicron variant. It really depends how big a mutation that new variant is. The alpha, beta, gamma, Delta variants weren't really big changes. And so the vaccine remained really effective. And your immunity from past infection was really good. With the Omicron variant, we're seeing both more people get reinfected, and we're unfortunately seeing the vaccine not work quite as well because of that big shift.
All right. Another question, we're moving now on to actually individuals that haven't been vaccinated. And there are a few questions that have come forward. And when you, and from your experience over the last year especially, what do you think is the most compelling argument to convince someone who is afraid that the vaccine will change their DNA, or that not enough studies have been done, to bring them on board to saying, yes, actually the time is right to get vaccinated? And there's a number of individuals in different ways framed exactly this question of saying what has worked, what hasn't worked. And we'd love your input on that.
Putting my hat on something hopefully the audience here is more familiar with, which would be marketing, is that you probably need to have a different message for different people, and you tailor the message to who your specific audience is. And ideally, you do a bit of that market research to help you figure out who your audience is and what is going to resonate with them. To give you an answer here, but not necessarily the answer that's going to necessarily resonate with most people, what I'd say is that we've done, close to 70 million doses of the vaccine here in Canada. I can't remember how many billions of doses of vaccine have now been delivered around the world, but 6-7 billion at least have been done. We have a really big track record now of how these vaccines work, how effective they are, and what have been the side effects from them. And so we really have a good sense of what the side effects are. Unfortunately, something like changing your DNA, that just doesn't happen. Theoretically, it's not possible for that to happen. It's never happened with a vaccine in the past, and it's absolutely not been seen with this vaccine. The kinds of side effects that we know of, that the most worrying one, of course, is the myocarditis and pericarditis that our mRNA vaccines cause, more so in young people. Fortunately, low risk, we're talking, 1 in every 50 to 100,000 people might get it. And most people who get it really just recover at home. They never even need to be seen by healthcare and get any kind of additional care from that. And of course, your risk of getting myocarditis or pericarditis is actually greater with COVID infection than it is with the COVID vaccine. So I would say the trade-off is very good there, because if you're not vaccinated, with the way, say, the Omicron variant is spreading, and particularly as we get to a point where we're not going to be doing a lot in society to stop the spread of infection, your risk of getting infected is going to be near 100%. So you're going to get that risk of, the side effects from the vaccine or the long COVID from the vaccine, and unfortunately those unfortunate chances where someone might be hospitalized. And so, get the vaccine. We know that's safe. We know it's going to give you really good protection, especially from being hospitalized. And you're going to be able to make sure you don't end up in a hospital or have a severe outcome or get long COVID or one of those other outcomes.
That sounds good. Dr. Hirji, in your overview that you gave us, you looked at a Canadian-wide forecast on what to expect when we actually can see hospitalization likely to drop, and that was in looking at early February, I think was the data, early to mid-February, where the forecast is currently at. The question from one of our attendees here is, do you foresee an extension of the current regulations as they stand?
Yeah, I talked a little bit about this in my presentation. I suspect we are likely to see an extension of those regulations because I think while the new hospitalizations will have come down, the hospitals will still be stressed with all of the people already in hospital who have not yet recovered, and we'll still be adding new hospitalizations at a modestly high rate still. And so I think it's probably going to end up being a bit early, and we're going to see those measures extended. Hopefully things really radically change over the next 9 days, but I'm not very optimistic that will happen. There's also a possibility here that maybe the regulations don't get extended in their current format. Maybe they get extended in a modified format. So there's a partial lifting, but they are extended a little bit more. It'll really depend on how the government assesses the situation over the next 9 days or so, what we end up with, though.
Yeah, and I think that likely relates to a couple of questions that come forward regarding group gatherings and getting together, and we really do have to wait for what the update is from the Ontario government on this one. I want to shift over to one particular one. The government of Canada earlier this week has received its initial shipment of 30,000 treatment courses of Pfizer's oral antiviral treatment for COVID-19, with 120,000 more expected to be delivered between now and the end of March. And Canada overall has secured 1 million courses of the treatment in total. What does its role play? How has this become an additional tool? How do you see it being implemented in our overall way of dealing with COVID-19?
Yeah, so what's really significant about this medication is it's the first medication we've had for COVID-19 which is basically a pill that you can take at home. We've had other medications, but they all require you to visit a hospital or an outpatient clinic, get an IV medication. So what's really significant is now a physician could prescribe you a medication, you'd get the medication from the pharmacy, take it at home. And what this medication will do is it's upwards of 90% effective at preventing you from being hospitalized. And so the way I see it playing out is we'll really target people at higher risk of being hospitalized. People who are unvaccinated, people who are older, people who have underlying medical conditions that put them at greater risk. We'll really prioritize them to get a test for COVID-19. And if they test positive, prescribe them this medication that'll hopefully give them that treatment so that they can have a mild course of illness and not end up being one of the people that gets severely ill and needs to hospital care. And that'll, of course, reduce the pressure on our hospitals. It'll, of course, keep people healthier in our community. So I think it's all very good news. My only worry here is that 30,000 doses sounds like a lot. We sadly are seeing tens of thousands of people test positive across the country every day for COVID-19. I don't know what fraction of those might be eligible for this medication, but I could see those 30,000 doses going quite quickly. And of course, the entire world is trying to buy up this medication. So I think it's not going to be in as plentiful supply as we would ideally like it. And we will probably need to ration it a little bit. Hopefully over the course of months, though, we'll have a lot more supply of it, though. All
right. I'm conscious of the time, and I'm because we only have about a minute or two left, but there's Amanda has emailed us and utilized the chat, and so I want to ask about minor sports for kids and teens and returning to normal activities. Physical activities are critical to our mental well-being, our physical well-being overall. They're so critical to us, and especially at that age group as well. Where do you stand on it? Where do you see it? Is it coming back? What is your, if you're looking at the first quarter of 2020 and maybe then looking into the second quarter, what do you foresee happening?
Yeah, so as you say, sports really important for children. Of course, like any activity where you're around others, infection can spread to it. And we've sadly seen actually sports tournaments have been linked to outbreaks in young kids and actually led to infections and outbreaks occurring in schools. So we want to be, I think, somewhat cautious around this. I'm hoping that, as we get past the Omicron wave, perhaps even in March or April, we'll be back at a point where infections are low enough that we can open this up. I would also think that I would like to see these maybe open up with a proof of vaccination requirement similar to what we have in other high-risk settings, because I think sports could be a high-risk setting, and that would be a way that we can open it up for at least the fully vaccinated earlier.
Yeah, that makes sense. Conscious of the time, your time, and the time of our participants. So, Dr. Hirji, as always, I really do appreciate our time and the time that you give us. Can't even imagine what your day looks like, but it's been so greatly appreciated. And we hear the feedback regularly from the business community of being able to connect with you directly has been critical for the workplaces, critical to keep their employees and their customers safe at the same time. And you have their commitment to that. Thank you to all the participants today. It's always really nice to connect with you, and it will hopefully one day soon be in person versus in this format, because I think it would be really welcomed from all of us. But this session, as always, has been recorded and will be available. It will be directly emailed to you, and it is also going to be available on our website. If you have any further questions regarding subsidies, rapid tests, and other things, please feel free to reach out to us, info@gncc.ca or mishka@gncc.ca. We're here to help you and to move Niagara forward. So thank you very much. And to all of you, stay safe and shop local. Bye-bye.